Okay, thank you. Thanks for the opportunity to talk with you today. What a great start to thinking about the potential for remote social connectivity. So I'm going to talk about how mindfulness meditation training might be useful for reducing loneliness. I'll focus specifically on one study showing that learning to accept our present moment experiences is the important ingredient here. And that this skill can be trained remotely rather than in a social context. So we're all here because we understand that loneliness can take a huge toll on mental and physical health. And in fact, in terms of physical health, loneliness and social isolation are among the most robust risk factors for poor health and accelerated mortality. Comparable to smoking, physical inactivity, high BMI, etc. And this is because humans are fundamentally social beings, and social isolation represents a sort of threat to our survival. This feeling of threat is thought to help people change their behavior in ways that restore social connections. But feeling this threat also increases vigilance and reactivity towards negative social interactions, which can then change social behaviors in ways that actually reinforce feelings of loneliness. So it's easy to get stuck in this sort of downward spiral of social isolation and loneliness. And so far, there are relatively few evidence-based interventions effective for reducing loneliness and social isolation. So, mindfulness meditation interventions have shown promise for reducing loneliness, improving close relationships, and fostering compassion for others. And some of this evidence comes from remote, individually delivered mindfulness interventions, suggesting that the social factors present in many mindfulness interventions may not be essential for improving social functioning. So if it's not the social context that makes mindfulness training effective, then what is it? So we think that it may be the intrapersonal skills developed through mindfulness training that change how people perceive and behave in their social environments. So I'll describe a study today that explores what unique skills trained in mindfulness interventions are essential for reducing loneliness. Okay, so first let me describe how we define mindfulness. It's a practice of monitoring experiences as they occur in the present moment with an attitude or orientation of acceptance, openness, and equanimity toward all of these experiences. And we've hypothesized that it's this acceptance that's a key emotion regulation ingredient, explaining how mindfulness impacts social functioning. So the theory goes like this: by enhancing awareness of momentary experiences, monitoring by itself might magnify uncomfortable feelings of loneliness and social threat. But in contrast, acceptance begins to change a person's relationship to their experiences. So bringing this attitude of acceptance toward all experiences, even difficult ones like loneliness and social disconnect, can help to diminish this social threat, avoidance, and other obstacles that can hinder social engagement. So we think that monitoring and acceptance together can mitigate social threat, and that removing acceptance training from a mindfulness intervention should eliminate the benefit for loneliness and social interactions. So I'll talk about this study that experimentally tests this question, and in particular, testing how acceptance training impacts feelings of loneliness and social contact behaviors. So to do this, we developed 3 smartphone-based interventions that dismantle the components of mindfulness training. The 3 programs had 14 20-minute audio lessons. And the smartphone format not only evaluated the efficacy of remote intervention delivery, it also controlled for social factors to establish the contributions of these mindfulness-specific skills. So we compared a full mindfulness meditation program that trained people to monitor their present moment body experiences with an accepting and welcoming perspective. This is the Monitor Accept group. A mindfulness program that trained people to monitor momentary body experiences with no acceptance content. This is monitor only. and an active control training program with no mindfulness content. It instead instructed common coping skills like reappraisal and problem solving. And all of these programs were well received with 96% treatment adherence. The whole study took place over about 3.5 weeks. People were set up to complete the intervention by themselves at home. And they listened to a lesson each day on their phones for 14 days. And then they completed assessments about their social interactions and perceptions of loneliness in daily life for 3 days before and after the intervention on their phones. And specifically, we assessed 2 primary social factors, the subjective experience of loneliness and objective social contact. Loneliness was assessed each evening for 3 days before and after the intervention, and more objective social behaviors, numbers of social interactions and numbers of social interaction partners, were assessed both in evening diary surveys and 4 times throughout the day in EMA surveys. We enrolled 153 stressed community adults, 2/3 female with some diversity. They were randomized to one of the 3 programs: monitor accept, monitor only, or control. 98% of the sample was retained, and there were no group differences at baseline. So to summarize, we predicted that monitor accept training would reduce loneliness and increase social contact relative to monitor only and control training with no differences in those groups. So that would suggest that acceptance then is the key ingredient of mindfulness interventions for social functioning. So first, people reported on their subjective perceptions of loneliness in end-of-day diaries. So the theory is that maintaining acceptance and equanimity with uncomfortable feelings of loneliness might begin to diminish the distress associated with them. And that would enable people to feel more comfortable with solitude. So here there's no baseline condition differences in loneliness. We have the monitor accept group on the left, monitor only in the middle, and control participants on the right. But the monitor accept trained participants had a 20% reduction in feelings of loneliness after the intervention, while the other 2 groups showed no changes. So these findings support this idea that developing acceptance is key for the effects of mindfulness training on reducing loneliness. We also predicted that learning to monitor present moment experiences with an accepting attitude would change social contact behaviors. So the idea here is that bringing an orientation of openness and curiosity towards social situations might encourage people to reach out and engage more within their social networks. So here, okay, so this is the total number of social interactions people reported in their end-of-day diaries. No baseline differences, but the monitor accept group reported a significant increase in social interactions, about 2 more social interactions and 1 more interaction partner each day following their intervention. This will show the same thing in EMA data, so I'll just skip over that. So to summarize, we found this consistent evidence that 2-week individually delivered smartphone-based mindfulness training was effective for reducing social risk factors, including loneliness and increasing social contact. And importantly, learning to accept present moment experiences is critical for these effects. So without acceptance training, there were no benefits of the monitor only group over the active control program, suggesting that it's not enough to simply bring greater awareness to the present. It's also crucial to train people how to attend to their experiences. This orientation of acceptance toward all experiences, regardless of their content, may change the way people perceive and behave in their social environments. And just to wrap up, we're in a situation right now where loneliness is rampant, and millions of people already use smartphone-based mindfulness training programs, which are more accessible, inexpensive, and scalable than in-person training programs. And especially these days with mandated social distancing, a big question is whether remote mindfulness interventions help to reduce loneliness. This program shows that it can, and what to look for in an effective mindfulness training program is acceptance techniques to learn to accept and be open to and welcome even uncomfortable thoughts and feelings.